Welcome everyone to this afternoon's webinar on hormone challenges with breastfeeding. Um, we we are about to start. We'll just give people 5 minutes to join the call, and then we'll start at 2:05 p.m. Thank you. All right, welcome everyone to today's webinar on common challenges encountered by breastfeeding mothers. Our speaker today is Dr. Wanjiro Gishuri, a medical doctor and lactation specialist. Her brief bio is as follows. Daktari is a medical doctor passionate about breastfeeding and maternal health in general. She's an advocate for breastfeeding and as a lactation specialist, she supports mothers and families through their breastfeeding journey, and she aims to create a community where all breastfeeding experiences are valued and supported. Thank you so much for taking time off your schedule to be with us today to teach us more on this topic, Daktari. I now hand over to you.
Thank you for having me. It is a session I wish and I hope to enlighten and help to feel our mothers supported and for them to know that support is available for them. So as you have mentioned, my name is Dr. Wanjiro. I am a medical doctor active in clinical, and I am also a lactation specialist. And I am a breastfeeding advocate. I support all families in their individual breastfeeding journeys. So I think I will go straight to today's discussion. We want to talk about the challenges that are faced by breastfeeding mothers. I want to preface this by saying that breastfeeding is a natural process. We all know that and we all agree on that. However, it's not easy. It is natural, but it is not an easy process. Once they hand you your baby, they put your baby in your arms, you do not automatically know how to go about it. Breastfeeding is a journey. For every mother and every baby, it is a journey of discovering each other and learning what works for them and what makes it better, what makes it easier. So we all need to be aware of this, and it's a learning curve, and it's a period that we have to give grace to each other and support to each other. So now direct to the challenges encountered. So these challenges, they're encountered in different degrees. So it's not all the same for everyone. So everyone will have their own level of how they go about it. So the one I would like to start with is latching difficulties. So latching, how would I define it? Latching is when you put the baby on the breast and the baby is actually able to, get a hold on the nipple and get the milk out of the breast. It sounds easy, but it really is not. And it is one of the most common challenges that will be faced after delivery. So while you're in the hospital, your healthcare workers, your doctors, the nurses, they will assist you with this latching. And what you need to know is, how do you tell if you have achieved a good latch? And one and the most important thing to know is that a good latch is not painful at all. I know there's a lot of misinformation out there. You will say that I feel pain when the baby latches, and your friends, etc., will tell you, yes, that is normal. And I want to say it is not normal. Latching, when a baby is well latched, there is no pain. So for latching, you try different positions. You just need to find what works best for you. But most importantly, because this usually happens in the very early days after delivery, most importantly, seek help. You need to seek help about it. Now, what is the problem with not achieving a good latch? So this brings us to the second point, and this is sore nipples. If the baby does not latch well on the breast, your nipples are going to suffer. There's going to be friction. The nipples are going to get sore. They will get painful. They can progress to cracked nipples, and this just becomes a vicious cycle. So once you've achieved a good latch and you have sore nipples, one of the things that you can do is you can use nipple creams. These are available. There are also nipple shields. However, these I would advise that you consult before you use them. Another home method that you can do is let your nipples air dry after feeding the baby. And again, as I said, seek help, because these things, there are solutions to these things. So just seek help before it progresses. The next thing that I would like to mention is low milk supply. This is very common. So low milk supply, there are two ways to go about it. It could be objective, like your milk supply is actually low. And these are very few cases. Or it could be subjective. And this is where a lot of mothers lie. We just feel like our milk supply is low. So number one solution is just to first find out, like, is your milk supply really low? Is your baby making urine? Is your baby happy after a breastfeeding session? How many diapers are you changing in a day? Your doctor will help you to assess this and to assess if your milk supply is actually low or not. Now, to talk about how to increase breast milk supply, the major thing and the only scientific proven natural way of increasing milk supply is by emptying the breasts. So the more you empty the breasts, and by empty, I mean completely empty the breast, that triggers your brain. And naturally, you will make more milk. You will increase your milk supply naturally. So there are other ways to increase milk supply. There are medications, there are herbs that have been used. These you need to consult your doctor before you get any of these things. So naturally, to increase milk supply, we said you empty the breast. You empty the breast by feeding your baby on a more regular basis. Feed your baby. The more you feed your baby, the more they take out the milk, the more milk is made. Another way is to pump the milk out. And then the most important one is hydrate. You need a lot of fluid. Drink all your fluids and obviously maintain a balanced diet. The next thing that I would like to mention is breast engorgement. So breast engorgement is where the breasts are full. Okay, so there's a normal breast fullness because milk has been building up, and the normal one, the normal breast fullness, when you breastfeed your baby or when you pump the milk and the milk comes out, then that's it. It eases up. The pain, the discomfort goes, and the breasts feel lighter, and you're okay. But now with breast engorgement, it is quite painful. The most common cause of this, it could be a blocked duct. So the milk is not passing through and the milk is being made. So the breasts become more and more engorged. And the problem is that when the breasts are engorged and they're painful, you don't want to put the baby on that breast. And for most people, you end up putting the baby on the other breast. And so the affected breast continues to get more and more engorged. So for this one, what we need to do is you need to seek help. Okay, we need to seek help, see what is going on so that it can get solved. At home, what you can do, you can apply some warm compression. So like a towel, you dip it in warm water and you just press on the breast. This helps to, open, dilate the milk ducts and keep it moving. You can do some breast massage, especially in the shower. It's a very good technique. You can do some breast massage. You basically just want to keep it moving. And for some people, pumping will take it out because you just need the pressure to go. We always need the breast to keep being emptied on a regular basis. Something else that is encountered by quite a number of breastfeeding mothers is what we call mastitis. So now mastitis is an actual infection within the milk ducts. So how does this occur? In most cases, we are back to latching. Your baby does not latch well. Maybe you do not have the knowledge, or you do not have the support, or you do not know the support is there. So you just keep doing it. The baby doesn't latch well. Your nipples get sore. the nipples get cracked. And you see, the skin is a physical barrier to infection, to infectious organisms. So when your nipples crack, then the organisms can get in. And once they get in, that is how you develop mastitis. So this is an infection in the breast duct, in the breast ducts. And for these, you do need to seek medical help. You need to be examined. You probably need antibiotics, and you need to be given home measures. So for this one, there's really not much you can do without seeking professional help. Then there is a difficulty of, some of these challenges that we face that are sort of unknown, and unless you talk about it, you think it is just you. One of them is breastfeeding in public. Mothers, they try to hide, and you know how hard it is when you're breastfeeding a baby and you're trying to cover up the baby and yourself, and the baby is kicking it out, and you get so anxious being out in public and needing to breastfeed your baby, but also wanting to cover up and not even being sure if it's okay to breastfeed in public. And then what happens when you're that anxious? The milk does not flow. So now the milk doesn't flow, and the baby is not happy, and there goes the crying. And if you are out there doing something with your baby, you'll probably cancel. So this is something that we all need to raise awareness on, that the law actually allows us to breastfeed anywhere. You are allowed to breastfeed your baby anywhere. You do not need to cover up. It is allowed by the law. Now, the other issues that we face is baby refusing to breastfeed. So now this one, it really depends, because on one hand, it could be that the baby is sick. On the other hand, it could be that the baby has had enough, or maybe they're just teething, or maybe they're just going through the motions, maybe they're having a recession. So if your baby is not breastfeeding, these you need to be checked out. The baby needs to be checked out. The baby needs to be okayed that they are not actually sick. And then we can work on other methods at home. So if the baby is not sick, what else can you do? Do a lot of skin to skin contact with your baby. Hug your baby. I know that our mothers in the previous generations, they're not really for that. They tell you, put your baby on the breast only when you need to breastfeed them, and then put them down. But I will tell you, no, hug your baby, hold your baby, do as much skin to skin contact as you can. And naturally, that baby will breastfeed, and this will actually increase your milk supply. Then there are those mothers who are working, who are going back to work for different reasons at different ages of the baby. And there is a lot of anxiety surrounding this. So this is your first baby. If you're an employee, then maybe you've been on maternity leave for 90 days, maybe 4 months, and suddenly it's time for you to go back to work and you need to leave your baby. And this is an exclusively breastfeed baby, and you're really trying to make it to the 6 months. It is a highly anxious situation. However, there are solutions to this. So I would suggest that if you're having any of these concerns, how do I go back to work? How do I maintain the 6 months of exclusive breastfeeding while back at work? There are ways that can be done. This is family specific. It has to be individualized. How to pump, how to plan pumping sessions, how to store your milk, how you can work it out to the employer, how to do the pumping, and eventually, with support, it actually goes very well. You're able to go back to work and you're able to achieve your breastfeeding goals. So then there are other issues that we face. You could have issues with pumping. There are so many different pumps in the market. You don't know which one to buy, or you don't know which one is best for you. You just want a pump. You don't know how to use which one. And again, I want to say that support is available. According to your situation, there is the pump that will work very well for you. then there are a lot of emotional challenges when it comes to breastfeeding from the beginning of it. Breastfeeding is not something that has been talked about for a long time. As I said, it's natural. And I think naturally everyone just assumes you have a baby, you're going to breastfeed. Okay. So it's not, breastfeeding support has not been a real thing for a long time. And a lot of mothers and families have gone through a lot of emotional challenges and difficulties related to breastfeeding, not knowing that they can talk about it, not knowing that the situation is not specific to you, that it is affecting more people, and that there are solutions. So breastfeeding support groups are very, very important. Or just, with other mothers, your colleagues, your friends. These support groups are very important because they help us to overcome all these emotional challenges that we go through during breastfeeding. And also, if your feelings of anxiety you feel are getting overwhelming, feel free to consult your medical provider, consult a counselor, because these things are real and these things happen, and there is support, but you need to know when to seek the support. So other things that breastfeeding mothers go through is the sleep. Babies when they're born, they do not have a circadian rhythm like ours, and they need to be breastfed a lot. Most of them 3 hourly, maybe more. So then you end up having sleep disturbances, you're not getting time to sleep, and how do you deal with that? And because of the emotional aspect of it, you don't really want to give your baby away the whole night so that you can sleep the whole night. And as you can see, this causes some stress on the entire family. So these are things that can be worked out. These are things that arrangements can be made that suit the entire family, so that even the mother is not overwhelmed as she's trying to meet her breastfeeding goals. So even as we discuss these challenges, it occurs to me that we should probably talk about why. Why are we concerned? Why are we talking about it? Why are we looking for solutions to these challenges? And the reason is because, as per WHO, breast milk is the best food for your baby up until 6 months of age. And after that, it is still very nutritious, very healthy, and recommended up to 2 years and even more. So for the first 6 months of life, all the baby needs is breast milk. That milk will feed the baby. It will give them antibodies that will protect them from illnesses. It will help the maternal bond to grow and develop. These are bonds that will last the baby. It is about the whole baby as a person and the mother. Dr. Marikela, I think that I'll stop there for the challenges, and we can move on to the Q&A.
Sure, yes, Dr. So far we have 2 questions. I'll just pose both of them. Both of them are from anonymous attendee. The first question from the first anonymous attendee is, what about low production? I personally struggled with this. And then the second question is, are there babies who just don't suckle the breast? What is it called? Some babies refuse the breast and feed from the bottle. So maybe your comments on those two.
Okay, so I will start with the first question on the low milk supply. This, as I mentioned, is one of the most common challenges that is encountered in breastfeeding. So I want to say that there are people who, for various reasons, are not able to produce breast milk. or are not able to produce enough breast milk. And these are issues that have to be addressed individually, because this could be due to illness, due to breast surgery or other illness that can be addressed. So for now, I'll speak about the people who do not have any of those medical issues. So if you're not producing breast milk, then that is something that will be noted in the hospital. And when you say that you're really not producing breast milk, remember, we can assess the baby. We can assess if this baby is actually getting fed. As I had mentioned, we can do a diaper count. You can express and you measure how much am I expressing and how much is needed. These are calculations that can be made objectively. You need this baby requires this ml after every X number of hours. So are you able to meet that goal? The other thing, how is your baby? Because a baby who's not breastfed enough, a baby who's not getting enough breast milk, that baby is not okay. That baby is irritable. That baby is dehydrated. That baby, depending on how long this has been going on, could even have fevers. So that baby is not okay. And that is a baby who can be assessed. Then we also assess with diapers. How many wet diapers are you changing in a day? And obviously, we also check the baby's weight. Is the baby growing well? So this is a way to tell us if you really cannot produce breast milk, or if objectively your breast milk is little, it is low supply that meant, versus subjectively do not produce enough breast milk. So if we have objectively seen that this mother is not able to produce enough breast milk, then there are ways we can go about it. And the first one is the mother actually able to produce breast milk, but it is not enough? Then, as I said, there are medications that can be given that have also been scientifically proven to increase milk supply. And for those mothers who are not producing milk, then we'll have to deal with that I believe I have answered the first question. Remind me what the second question was, Dr.
Sure. The second question was, are there babies who just don't suckle the breast? What is it called? Some babies refuse the breast and feed from the bottle. So I guess the person wants to seek clarification on whether that is an issue.
Okay. Yes, that is an actual issue. That is an actual issue. And yes, it happens. I do not think there's a medical term for that. However, again, we need to establish this refusing the breast. What is going on? And at what age is this baby refusing the breast? Has it always been like that? Or is the baby suddenly, is it a new change, suddenly refusing the breast? So that's where we start. Now, for baby refusing the breast, the things you can do, you can try. Natural. It's natural for the mother and it's natural for the baby. Spend time together. There's I hope I am back online. Sorry about that. So as I said, spend a lot of time with your baby. Do a lot of skin-to-skin contact. This is just getting the baby to want to breastfeed. As long as, again, we have made sure that this baby is okay. They're not refusing to breastfeed because they are unwell. That is something that we must be very cautious about. The baby who's not breastfeeding, we must be cautious so that they're not sick. So if the baby is okay and they're refusing to breastfeed, this is where I am saying spend a lot of time with the baby, do a lot of skin-to-skin contact, do a lot of bonding with the baby, and see if they'll go back to breastfeeding. So if they are preferring the bottle, then most of the time, there is a social aspect about it. So as I said, it depends at what age did this occur? Okay, and these can be addressed per individual situation, because as I said, there is most likely a social aspect to it. And obviously, as babies grow older, they get disinterested, or rather, they get more interested in the environment. So, like for example, a newborn, a neonate, all they're looking at is the mother. As you hold your baby, all they're going to look at is your eyes. But then as a baby grows, then they start to notice light, they start to notice other things in the room, they start to notice other people, they start to notice distractions, and then they start to look like they're not interested in breastfeeding. It doesn't mean they're not interested in breastfeeding, it's just that these are growing babies and they have discovered everything is new to them. So they've just discovered the new environment. So these are things that, as I said, are assessed on an individual basis and can be addressed. Daktari, back to you.
Asante, Daktari. So the next question that we have is, could you please elaborate more on breast milk storage?
Okay, yes, that is actually an important question. So breast milk, it depends. So when you express your breast milk, it depends on how long you plan to store this breast milk and how long after expressing you are actually going, if you're going to refrigerate it. So there are standard guidelines on how to store breast milk. So what I'm going to give is just the standard. Now, if you're, okay, first I want to say this, when you're expressing your milk, you need to label it. So there are breast milk containers, those nice little bags. The best way to store this milk is you don't need to fill the whole bag. Just put what would be enough for a feed. Because remember, if you freeze the milk, once you thaw it, you cannot refreeze it. So if the bag is full and you cannot do a full feed, then you end up wasting a lot of milk. So what I want to start by saying is, you don't need to fill up the whole bag. Just do one feed, one feed, one feed. That's number one. Number two, label the milk. Okay, we know the milk is just yours, but if you're like expressing at work, then you need to label. But now I'm talking in the situation where you are at home. Date the milk, like the date which you expressed the milk, also the time that you expressed the milk. The reason for this, one, is because when you're giving the milk to the baby, you want to thaw the one that has been in the fridge longer. That's the one you want to give first. So, for example, we are in July. If I'm giving breast milk, I'll give the one I expressed in January as opposed to the one I expressed in June. I hope that makes sense. So that's why you're labeling the date that you express the milk. Another important thing, depending, will be the timing. So according to research, breast milk is different. Breast milk is not the same. And this is why we say breast milk is a superfood. Breast milk is not the same. So the breast milk that you express during the day, for example, is not the same as the breast milk you will express at night. One of the main differences is that the milk expressed at night contains melatonin. Melatonin is a natural substance that we produce that helps us sleep. So you see the milk you express at night contains melatonin. Other differences in breast milk, but these are not differences that you would know. But if the child is unwell, then the breast milk that you produce contains more antibodies specific to the illness. Okay, so then these are different types of breast milk. So as I said, label first. Now, if you're going to freeze the milk, which is actually the best way. So let's start with expressing. You wash your hands, you prepare your expressing equipment, just prepare all of them, have them set up. you cleaned your machine, it's sterilized, it's dry. Now you wash your hands, you clean your hands, and you sit down, you express, and you don't fill up the whole bag, and now you're freezing it. So when you put it in the freezer, it can stay for up to 6 months. That is the best. However, it can go up to 12 months. It is viable up to 12 months. This is frozen breast milk. Okay. And now, if you're going to put it in the refrigerator, this is just the normal fridge. It can stay for up to 4 days. Only up to 4 days. And if you're going to put it at room temperature, you can only do 4 hours. Okay. And remember, then once you thaw breast milk, okay, this is a breast milk that was in the fridge, it is frozen, you've taken it out, you have thawed it. You cannot refreeze it. Okay. And also, I think at this point, I should also mention how to warm the milk. So when you get the milk from the freezer, one way you can, okay, do not put it in a sufuria and boil it, please. One way that you can do it, you can just thaw it at room temperature, or you can put it in water, like just in the pack, in warm water, you put it in. Then there are commercial milk warmers, and those are also good. At this point, I will mention warming in the microwave. So the problem with warming breast milk in the microwave, if you've stored breast milk, then you have seen that it layers. So it comes out in different layers. And if you warm it in the microwave, what happens is the heat does not get evenly distributed. So there are parts of that milk that will not have been warmed up, and that is not good for the baby. So that's why we do not warm it in the microwave. I believe I've answered the question about storing breast milk, and these I am referring to freshly pumped milk. So in summary, at room temperature is 4 hours, in the fridge is 4 days, in the freezer is 6 to 12 months. Yeah.
Thank you, Daktari. We're getting more and more questions, so I'll try and merge them in the interest of time. So the next question is a wet nurse an option for chronic low milk production? And does smearing the expressed breast milk help treat sore nipples?
Okay. So now, wet nursing. That is very individual. In theory, yes, it would be a solution because then the baby does get breast milk. But this is not something that is so easily achievable. But to answer the question, yes, it would be a solution. Then the next question was if you would apply breast milk on the nipple. And yes, I do remember mentioning for sore nipples, if you just let them air dry, you can apply the breast milk and just let them air dry. That does help with the sore nipples. So the answer to that is yes.
All right. The next set of questions, and actually the last two for now, is how do we avoid babies' regurgitation of milk? Is there a specific right way to burp a baby after feeding?
Okay. Now, I remember saying that this is a journey. Breastfeeding is a journey. The mother, the baby, you will have to learn each other. You'll have to know how to, which method works for you. So there is nothing cast in stone. There is no manual. Burping the baby, the several ways to burp the baby actually. And I think the most used one, I wish I brought my doll. The most one is where you, as soon as you finish breastfeeding the baby, then you put them up on the chest. And while they're in that upright position, just give it a few minutes and they will burp. Another one would be putting them over your thigh. So tummy down over your thigh. And yes, they will burp. Those are the two most commonly used methods of burping. Now, how to prevent regurgitating? Let's remember this is a little baby, and in that little body, they have all the organs that we have. So their tummy is small, the stomach capacity is small. So that's why we feed more frequently, not a whole, combined feed. Just feed more frequently because we feed less feeds. Now, there is no way, it's not practical to stop a baby from breastfeeding because you cannot know now that they've had enough. So if the best way that you can prevent this regurgitating is by letting the baby burp, because it's essentially the same thing. So as soon as you feed your baby, let them burp, because sometimes they suck in air during that breastfeeding session, and then that makes it very uncomfortable for them. So if you just let them burp, then later they will not regurgitate. Another good way is don't just feed, and then directly go to bed. Again, let them burp. Because if they directly go to bed, then they will regurgitate the milk. In some cases, then I said in some cases, you can use a pillow. It's not really advised. The best thing advised to put the baby, because they need to sleep at an angle. So the best way to do about that is to get some wedge, like a pillow creating a wedge shape, so that they sleep at an angle and then they don't just sleep flat. So this helps to put the border between the esophagus and the stomach so that it's not like a straight line so milk easily comes out. I'm trying to use non-medical terms here. So yes, those are the ways that you can reduce the regurgitation.
Thank you, Daktari. The next question is, what is the solution for mothers who do not produce milk totally and are living in a remote area and can't afford other forms of feeding, such as formula milk?
Okay, that is such a tough question. The best solution would be donor milk, donor breast milk. So that would mean us having milk banks, and the government would need to, facilitate that. Would need need to have policy that allows, checks the safety and standards of the milk being brought to the milk banks. So donor milk would be the best solution. Now, in a situation where the mother does not have milk, or even sadly, if the mother is not present and they cannot afford formula, then that situation has to be addressed on an individual basis. So there is no one size fits all. That is a situation that needs to be addressed on an individual basis. So what I would say is seek support.
All right. The last question we have in the Q&A section is actually more of a reaction from one of the attendees. And they say this: mine is a reaction. Kindly encourage fellow medics to be friendly and supportive of each other on matters breastfeeding. We are our own worst enemies. You can't deny a colleague time break to breastfeed, even if it's a junior. Thanks. So maybe discuss what companies and hospitals and organizations can do to have baby-friendly initiatives that allow them to breastfeed in light of that comment.
Okay, so that colleague has spoken for a lot of healthcare workers, a lot of us. Now, also, a lot of us are not aware of the Health Act of 2017. So this Health Act, you can look it up, but it does allow for pumping sessions, and it is very specific. It does state that if you have worked for 4 hours, you get a 30-minute pumping session. And if you have worked another 4 hours, you get another 30-minute pumping session. So this is law, And employers need to adhere to this. And she's so right that we need to support each other. It's not just healthcare workers, it's all the mothers out here. We need to support each other, because once you've gone through it, I started offering breastfeeding education when I was an intern, and I really enjoyed it. However, as soon as a couple of years later, when I became a mother, I did not know anything. Everything was new and surprising, and I was even shocked at myself because I was so confident. I thought I know this. So we need to support each other, because no one really knows. This is a learning curve. This is something that, natural as it is not easy. So we do have to support each other. Mothers everywhere, we have to support each other. And it's not just mothers. We also need the spouses and the rest of the family to be on board with us, because one of very common issues that mothers face, and they cannot even come out and say it, is pressure. So you get pressure from your family, you get pressure from your in-laws and your other friends who have gone through it, and they are telling you, it's day 3, you still don't have breast milk. Did you drink the porridge I brought for you? Did you eat this? Are you doing this? Are you doing this? So in the end, that mother just feels like they have failed, and the next thing that will happen is that mother will go to the shop and buy formula. So how have we helped them? How have we helped this baby? However, if this mother was just told, it's like this and like this and like this, then they would actually be able to meet their breastfeeding goals. So we need to learn to support each other. We all have different breastfeeding goals, but we need to support each other and understand that everyone's experience is different. Now, what can employers do? As I said, we have the Health Act of 2017 has provision for breastfeeding mothers. There are guidelines depending again on the company sizes, and sometimes it's difficult to put this into actualization because some people do field work, but it does say that depending on the company sizes, then you're supposed to have a lactation room. This room is supposed to have a sink for hand washing, a sink for washing the bottles, obviously soap. It is supposed to have a couch, a comfortable sitting space. It is supposed to have a fridge where you can store your milk. These are the bare minimum requirements. And I can tell you, this is not a common thing. This is not happening, which policymakers are working on it. We have the Kenya Association of Breastfeeding, and they're really trying to push for support for breastfeeding mothers, but we keep encountering a lot of challenges with policymakers and lawmakers, but we will keep pushing on it.
Thank you so much, Daktari. Those are all the questions we have for now. So probably we could use the remaining few minutes for you to give us any parting shots on the topic of today.
Parting shots. Can you hear me? So if I was to give a parting shot, what I will say is seek support. Just seek support. So we don't want to have support. There's some kind of confidence that you get, knowing that I thought I had this issue, and I talked to my support provider, and we solved it, and this is how we are doing it. Such that, because we are our own enemies, and I will tell you that our families, the other generations, they're not the same as us. They were not brought us up the same way. So even the place where you seek support matters, because you see things have changed. So like a long time ago, I think I spoke to my grandmother when I was a mom, and she told me, no, when you breastfeed your baby, you put them away. When you breastfeed your baby, you're not supposed to look at them. You're supposed to look away. No, you're not supposed to play with your baby. But these are teachings they were taught so that they can be able to leave their babies and go to the shamba and all. But now we know that things are different. So if that is your support system, you will do your whole motherhood journey feeling so guilty, feeling already you have failed. And these people without the right kind of support are the ones who do not make it to the 6 months of exclusive breastfeeding. But if we seek the correct support, and if we know that there is support out there, and we allow ourselves to be vulnerable and seek support, then we will meet our breastfeeding goals and objectives. So my parting shot would be seek support.
Thank you, Dr. There's one question that just sneaked in as you were giving your parting shot, and we still have time. The question is, donor milk banking at Pumwani can also be scaled up across counties. Is there any progress to date?
Unfortunately, as I mentioned, the Kenya Association of Breastfeeding is really trying to push. But even creating awareness is a problem. How many people are aware about the milk bank in Pumwani? How many people can trust and say, I will get donor milk? So we have a long way to go as a country. And it's not only in matters breastfeeding, it is not only in matters healthcare. I think you'll agree with me that as a country, we have a long way to go. So what I can say in terms of breastfeeding is the Kenya Association of Breastfeeding is really trying to push. And hopefully one day we'll get there. We will have these donor milk banks across the counties, and that would be a wish come true. That would be a blessing. We are working on it.
All right, that's reassuring. Final one that I will take is, it's been posted on the chat. The question is it possible for a child to be allergic to their mother's milk? And they define it further by saying approximately 6 hours post breastfeeding, their skin turns and gets a rash and turns reddish. So I think this is more of a experience question. I'm not sure that we will be able to cover it, but I leave it up to you, Dr.
Okay, so I will start by saying that in medicine, we never say never. So I cannot say that never, ever, ever can somebody react to their mother's breast milk. However, is this really an allergic reaction to the breast milk? There are cases of breastfeeding jaundice. But cases of an allergic reaction to breast milk, we really need to be sure that that's what this is. I understand this is an experience question. So if you have such an experience, then you need to seek medical advice, see what is going on, what is the person reacting to, because breast milk is made specifically for that baby. Breast milk is not foreign, okay? And so allergic reaction would be quite rare. I'm not going to say never.
All right. That's it for all the questions. Thank you so much, Dr. Gishuri, for the insightful lessons. I think all of us today have learned how to tackle the common challenges and also some interesting facts like the donor milk banks and where we are at as a country. On behalf of Kenya Medical Association, we say thank you for the session and the insights shared. And we welcome you to our next session, which shall be communicated on our channels. For now, we just say thank you very much, and you will find this recording in a few days' time on our YouTube channel. Till we meet again, thanks.
Thank you. Bye.